Let's do this. Wait, have I done this? Whoa, what did he just say to me? He just said like, honk, honk.
Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint.
Okay.
Are you ready?
No.
Today, our patient is a 76-year-old man. It is mandatory to check the patient's vital signs before beginning surgery.
Okay.
An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery.
Okay.
Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
Yes? Yeah? No.
Actually, our patient's vital signs are in the normal ranges.
No, I played the eyeball one. I haven't played
surgery.
knee surgery.
Take a moment to look at our patient's x-rays. Which knee do you think needs surgery? You're right. His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand.
Before even training
Now it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong surgery. Nope.
Just me, Gabe Newell. Use the marker, write your initials on the person's left leg. Big dick. And you smile. Oh, wait, it wasn't a big dick. It was a guy with a really nice hat on.
The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform? Great.
Oh, 3!
No. Nope. Good work. Fantastic. After the patient is unconscious, and before the first incision is made, we need to establish a sterile field around the surgical area.
Why is his knee up?
A series of sterile drapes isolates the surgical field from the rest of the patient's body.
Okay.
A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery. To kill the bacteria on the patient's leg, clean it in a betadine solution.
Here we go.
This scrubbing process will limit the chance of bacterial infection.
Okay, here's what we're gonna do. I just wanted to draw on his leg again. Okay, sponge. Here we go. Oh, moisten that shit up. Oh, you're gonna be so hot. It's a spray on tan, basically.
Betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes.
Oh, okay. I don't know why there's not like a brace.
Why do you think knee surgery involves so many drapes? Use the sterile marker to draw the location for our incision, and don't forget to mark the perpendicular lines too. Typically, the incision line is 6 to 7 inches long.
Oh yeah, look at those jiving hands.
What purpose do you think the perpendicular lines serve? Outstanding.
Yay.
Now for the incision. Take the scalpel and cut the skin following your markings.
Okay, wait, what am I doing? Okay, this is gonna get bad. Oh my!
Use the bogey pencil to cauterize the veins.
Okay.
This will help decrease blood flow into the surgical field.
Yeah. I'm trying. What the hell, do I click on them? Oh, I do.
The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed. Now the legs at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about.
I'm cutting them all off. Good.
Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device.
That's cool.
The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed.
I swear to God, I've played this before,
the pins to hold the jig.
Sick. Okay, Mielit, I can feel my knee hurting right as we speak. Okay.
We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component.
Yep.
Another cutting jig, along with the bone saw, allows us to finish shaping the femur.
femur's a square now. Good.
Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia.
What?
This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins.
Hammer time!
Use the bone saw to cut off the top of the tibia and prepare it for the new tibial components. Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella.
Okay.
Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial components.
Yay.
First, attach the femoral trial component.
Okay.
Attach the metal tray trial component to the tibia. Insert the plastic trial spacer into the metal tray component. Lastly, attach the patellar trial component. Why do you think the two tibial components are inserted separately instead of as one unit? Conduct a range of motion tests to assure proper knee alignment and successful prosthetic fit. Typically, knees aren't meant to bend sideways, so it's important to determine whether there is a gap or space between the femoral and tibial components. There's no noticeable gap, so this knee is a good fit. Why do you think there are so many steps taken to ensure proper alignment? We've tested the trial components. Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone. A scrub technician has mixed up a batch of cement for you to use. With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away. Lay the leg flat on the table so the new knee components put pressure on each other. This allows the bone and components to bond with the cement.
Does this hurt you? Does this hurt you? I bet it does.
Cement can take anywhere from 10 to 15 minutes to harden. We perform our range of motion tests one final time.
Does it hurt? Does it hurt when I do this? When I do this, does it hurt? There you go.
Our patient's new knee is looking good. Let's close up the incision. First, suture the deep tissue and fat layers back together.
Just click on everything. Whoa! I'm really bad with a needle.
For closing the surface incision, you have a choice between the stapler and the suture.
Stapler. Yeah. I bet this'll look cool.
What is the primary difference between these two methods of closing the incision? We couldn't ask for a better participant. You've done an excellent job. Are you sure this is your first total knee replacement? Our patient will remain in the hospital for 3 days, followed by 3 to 8 weeks of physical therapy. Because of this surgery, our patient will have significantly reduced pain and increased mobility. Before you leave, let's think about the life of the new knee components.
Oh, wow.
What kind of forces do you think the new knee will need to withstand? The people average about 5,000 steps per day. Our patient's new prosthetics will withstand a great deal of force, for 36 million steps or more. I'm off to check on another patient while the OR team prepares the room for the next surgery. You've been a great help. See you next time.
You're welcome. Okay, that was a great... Is he just gonna stand there and flap his gums? Oh, my mouth is so dry. This sour licorice is getting me all antsy. Yeah, no, he's just gonna stand there and do that for a while. Is his head moving too? Okay. Well, either or. Let's play a different game. Maybe... Oh, Brain Stimulation Index. That doesn't sound... Nope. I've already played Frictions. I played that. Killer Escape. I think I played that. What else is there? Duff Chick, why are you not a mod? I thought that would have fixed itself, but let me try remodding you. Added you as a mod twice. Game of the fucking year. Does anyone else have either really bad games or more surgery games, please? No, I played Don't Shoot Your Pants. Brain Stimulation. I don't even want to play, like... it doesn't sound like a game. Mutant Fighting Cup. That doesn't sound like a game. Brain Stimulation. Oh, this is just the brain surgery. I've done brain surgery. You know me. Dark Cut. I've fucking... That game's beautiful Master Mode gifts. Have you guys seen Dark Cut? I might make an excuse and play it twice. I fucking love that. More surgery games. Dark Cut 3 was ridiculous. I didn't even know they made that. I played Dark Cut 1 and 2 when I was a kid. And that fucking creeped me out. You have more surgery games? Do it, man. Just do it up. I'm gonna let you do it. I've done brain surgery before. Brain surgery. K-Bra, I said I did that game already. Seems to be triple modded. Does it? I don't know what's going on, Duff Chick. I'm sorry. I'm sorry. What is this? The Bad Plastic Surgery game. Wait, did I play this? Is that the one with the characters that look like kind of like cube things? Let me see it. Let me see it first. Let me see it first. Liquid generation. I don't think I played this. I don't think I played this. Let's see what happens. Let's just do it. I don't even care. Let's see what happens. Screen region. This. To this. So groovy. Manga was too slow. Virtual hip replacement. Okay, I'll keep that on the side. Let's do it. Let's do Janet Jackson. Oh, am I guessing who it is? Michael Jackson. Probably Christina Aguilera. Oh, it was Tara Reid. That one. Oh, darn. Cameron D. Oh, it was Applegate. Courtney Love. Britney Spears. Al Pacino. Oh no. Oh my god. Oh my god! Well, that happened. I heard celebrity boob jobs at Liquid Generation. Play the Bad Plastic Surgery game. Get this image. Wait, get this image. Click here. Like, download that. Well, that happened. I'm not gonna play that. I'm gonna play this. Oh, yeah. Oh, yeah. Oh, look at the receptionist. Reception. Why is she moving so weird? Alright, whatever. Let's do it. Click here, scrub those hands, and grab a retractor. Click here to begin. No, do it. Surgery photos. That'll happen after.
Hello, and welcome to EdHead's Virtual Hospital.
Hi.
I am the resident surgeon, Dr. Fisher. Today, you will help me perform a hip replacement surgery. Before we scrub in, let's complete the pre-op work for this patient. Ready?
Go! It's a race to it!
The patient is a 62-year-old female with fairly healthy bones. She is 5 foot, 8 inches tall, and weighs 190 pounds. Based on this patient's x-rays, which hip do you think needs surgery? Great job!
Yeah.
As you can see, most of the cartilage or cushion between the bones is gone.
Or cushion.
Especially in the upper portion of the hip joint.
That's the technical term.
Now, we must template or measure the hip to determine what size prosthetics to use. I'll hold the templates up to this x-ray, and you find the correct fit.
Sex-ray.
The stem, a metal piece that will fit into the femur, should be no wider than the canal in the middle of the bone.
I don't think I played this
Which
one.
size stem do you think works best for this patient?
Right up in there.
No, not quite.
This one.
No, not quite. No, 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 no.
That
not
porridge
quite.
is too hot. That porridge is too cold. This porridge is just right.
Great work. Now we need to determine the size of the metal cup.
Okay.
Again, using a template.
Okay.
Which size do you think will work? Nope. Yes, that is correct.
No, yeah. You've done it. Wink.
The OR team has prepped and draped our patient. We are now ready to operate.
It's just a leg.
First, locate the top of the greater trochanter bone and use the sterile marker to mark the incision area.
Fucking big dick on there. That's a really awkward dick. Just looks like 4 fucking... Look! It was a soccer ball all along! And color in this part. And there's this guy kicking it. But he's really far away because he kicked it really far. And he's holding a beautiful lock of hair.
Start 3 centimeters
They're gonna keep that
above
there.
the greater trochanter and go down 5 to 10 centimeters below the greater trochanter.
Okay, what's that? Oh, I don't know what that is. That's a guy. That's his nose. That's his head. And he's talking. He's jibber-jabbing. What a guy. He's kind of crotchety. He's got a spine problem. And he's touching the soccer ball.
Pick up the scalpel.
Oh,
Carefully
no.
cut through the skin and
Oh,
the
no.
subcutaneous layer of fat.
Dadders!
The incision line. Wait a slice. Let's use the Bovie pencil and cauterize the vessels to reduce blood flow. Now use the lap sponge to soak up the remaining blood. Insert the retractors. Using the scalpel, cut through the gluteus maximus muscle. Again, cauterize any blood vessels using the Bovie.
I'm cutting
Pull back
into
the
that
split
ass.
muscles using the deep retractors.
Yes!
You must be
Pull that
careful with
open.
the sciatic nerve.
Oh!
It is
I'm at
critically
least like
important
3
to
ass
protect the
levels
sciatic
deep.
nerve through this
Oh,
procedure.
this-
Good job!
Wow, okay.
I already cut the 6 muscles
We
that connect to the
destroyed
top
those
of
tendons.
the femur. I then
Well,
folded
not
the whole
tendons, whatever.
set of muscles back as one flap.
Uh-huh.
Now, we are able to see the flexible sac, or capsule.
I just
Next,
cut your
dislocate the
sac.
femoral head by flexing. You
Oh
can now
my
see the back
God,
of the
no.
femoral head and how
Okay.
arthritic the joint is.
Mm.
Before we saw into now, take the bone saw and cut through the neck of the femur. Remove the femoral head.
That's mine
During
now. You don't get that back.
pre-op templating, we decided to use a 52mm prosthetic cup.
Sitting hurts
We will need
now.
to use reamers that are slightly
Sitting
smaller
hurts.
than that in order to prepare the bone
Oh,
for the
I put
cup.
that in.
Let's start with
Oh,
a
that's
46
blood.
millimeter
Oh, what am I
reamer.
doing?
Why should we try to? Yeah. I'll finish
Yeah.
with a size 51mm reamer, preparing the acetabulum for the prosthetic cup. Note that we are staying one size
Oh,
smaller
stop
than the
doing
final
that, please.
52mm prosthetic
Oh, my
cup. This
God.
prosthetic cup is mounted
You're
on an
pulping her
insertion
inner
device,
ass.
which also serves as a guide to achieve
Eh.
correct orientation. Align the insertion device with the guides. The part of the metal
Did I
cup
do
that
it?
is in contact with the bone is rough, allowing the bone to attach or grow to the cup. This is known as bone ingrowth and is important to the long-term stability of the prosthesis.
I
Tap the cup
fabulous.
into the acetabulum until the bone completely surrounds
eh.
the plastic liner will act as a cushion between the metal part
Smash
of the
that
prosthetic.
ass.
Tap the plastic liner into the cup, and I'll lock it into place with
Do
an
it.
expanding metal ring.
Please do. Wait.
The liner is not great work.
Not great
Place a
work.
retractor directly under the femur, near where you removed the head. Use the box osteotome to cut a rectangular segment out of the femur. This will allow access to the medullary. Remember, we templated this patient to a size 13 bone. Start with a size 12 rasp to size the bone for the stem prosthetic. Use the mallet to tap the rasp into the bone.
Oh my God! No!
Good. I'm going to rasp the bone again.
No, don't do
using
it
size
again.
13.
Oh my God.
Take the handle off the final rasp.
Ah!
Place the charred ball onto the end of the... I'll pop the ball into the plastic cup.
Do it.
Now we're ready to test the range of motion, making sure all
There you
the
go.
components
You're fine.
are the correct size
Ah, we fixed
and that
your
the
butt.
leg is able to move freely.
God.
The first test is leg length. Check to see if the kneecaps and the heels align with each other. Are they in alignment? Great job!
Was I right? It didn't
Next,
look like it.
Great. This indicates a good range of motion in those directions, and that our patient's hip will be stable.
Will it?
Now, let's check the forward. It looks like we have good motion in that direction.
Take a bitch.
Now move the knee down toward the table. She has about 60 degrees rotation in this direction, which is a good number.
It's a good
It
number.
looks like the prosthetics are a good fit for this patient. I'll dislocate the ball from the plastic cup and remove the ball and the rasp.
Oh.
Before we put the real prosthetic stem in, the osteophytes or bone spurs will need to be removed. Use the rongeur to remove the osteophytes. Why does the patient have not? Yes,
Not
that is
yes.
correct. Finally, tap the prosthetic stem into the femur bone. Place the ball on the end of the stem.
That wasn't that bad.
I'll pop the ball into the plastic cup.
No,
We're
love that.
almost finished.
Beautiful
Let's
sound.
close up the incision.
Do it.
Take the
Oh,
suture
I gotta
down
do it.
through the piriformis and using the needle, I'll close the gluteus maximus and then the tensor fasciolata tendon. Now you suture the subcutaneous fat together. This is an important step to... Now use staples to close the skin. The OR team will bandage the incision. You've done a great job. I can see a promising career in orthopedics for you. Our patient has made it out of the OR and will stay 2 to 3 days in the hospital, followed by 6 to 8 weeks of recovery and physical therapy. This will allow her muscles to heal and strengthen.
7 to 8 months.
She should have significantly less pain and a much higher quality of life. Come back and assist us anytime.
Assist me. I need assistance. Let's see what it looks like for realsies. I don't want to click on any of these. Especially not number 6. 6 looks a bit meaty. A little bit too meaty for this guy. Should I click on number 6? Let's not. Nope. I should. Are you ready? I don't want... Hot dog! Oh! Yeah! Ah! Yeah! Yup! Okay, I'm not gonna fucking... That's done. That's done. Holy dicks. That happened. Anyone else got any awesome surgery games? Because that was awesome. I learned so much. Dude, it's beautiful. Love that. Hot ass. Surgeon, I've done that one. I fucking hate balloons and tower defense. I don't know what that is. I saw her standing there with a twitch in her eye. Actually, that's girlgames.com. I'm gonna play that. If anyone else has any more... Whoa, there's a motorcycle. Did you see that? You missed it. There was a motorcycle. Anyways, if anyone else has any more surgery games, that was good. Frog dissection. I might have to do that. Oh, no, it's a zombie game. I've played this. It's actually good. Let's dissect a frog. Oh, yeah. Whoa! Virtual frog dissection! Now I don't actually have to kill a frog. Oh my god, this is pretty high def. What do I do? It's on the pin. Okay, did I pin it? Oh, I got it. Where is it? Oh my... Oh, I can leave those there? I don't think I can. Yeah, I'm not allowed to. Dissecting a frog. Here we go again. Hip replacement. Now I know what to do. That wasn't that bad. But then it gets worse. I've dissected a frog. Oh no, it was a rat. Oh, okay. That's not that bad. Alright, I gotta pin him. I forgot. What do I do? This is a knife. Just take the... Got really meaty in the middle and it got hard to cut. One more time. Baby pigs. Oh yeah, I've heard that. Oh. It's like a learning exercise in learning. Oh, took those out. Identify the organs. Heart. Is that really? Wow, okay. I'm just clicking on shit. Lungs, please. I clicked on the lungs? Is that... Whoa, that just looks like a big poop. Is that the... That does not look like... They look like the kidneys. Okay, that's the bladder. I think. Well, I missed the liver. Or the lungs, I'm not sure. You've completed the virtual frog dissection. How'd I miss the liver? Is that the liver? What? That's not... I'm confused. Okay, I think those are the kidneys. Those are the lungs. This is the liver. But I don't know. The frog just looks so weird. So weird. Okay, well that was boring. No, I was kidding. It was disgusting. What's another good game? Any more surgery games to earn franchise? Heart surgery. You won me. Let's do it. Is this really high def or is this really silly? I hope it's really high def. Oh, it's really high def. Look how happy she is. Oh, you're brand new. Let's get you working on again, man. How to play my ass. Let's play. Don't try this at home. Your house could burn down. A boy, a child. I'm doing it on a child. He's dead. He has a lot to live for. Here's the stethoscope. Let's listen to your back. You sound good. Let's take you to the heart room. Here we go. I'm gonna kill a boy today. Okay. Oh, it's not right. It's not right? I thought we had to sterilize it. What the hell? Oh, I gotta grab it with a cotton. Fuck you. Put that on your nipple. You guys fucking... Okay. This might be the guys that did heart surgery. Draw a line. Oh. Oh no. Oh fuck. Oh! Grab a scalpel. Ah, God, I'm sorry! I'm so sorry! I can't move it, it's stuck. Okay, that's the perfect incision. I'm sorry. Ah! Clamp! Right there. Oh my God, it's right there! Oh, it's right there! Okay, take another clamp. Where's the other clamp? Oh no, I'm sorry. I'm sorry. Ribcage block. Bone scissors. Oh no. Oh, I'm sorry. I'm sorry, little Jim Jam. Oh my fucking shit. I gotta hurry. Remove bone fragments. Why are you dying? Why did you have 5 minutes to live when they gave you to me? Put that right in there. With string? Just fucking string? Tie back the nerve. With what? With string? Oh my God, don't cut the red wire. Attach the red wire. Okay, B, they're color-coded. This is easy, I got this. Nice, Doc. A, B, C, D. Heart surgery is easy. Okay, what are we doing? You grab a tube and just drag it. Oh my God. Oh, what am I doing? Are these even attached? They don't look attached. Remove Joe's heart. Sharp-tipped scissors. Oh, I did it. Okay, I gotta be really fast apparently with this. Sharp-tipped scissors. Red, blue. Okay. Green. Okay, now, scissors. And here. And yellow. Nice. Grab the heart. Oh, I got it. I got it. Okay, new heart. Focus, Doc. Perfect fit, apparently. And then we just suture. Wait, we're actually suturing a heart? That must be a really tight suture. Okay. Is this it? Did I do it? Pawns? Okay. This wasn't as hard as I thought. Uh-oh. Uh-oh. Uh-oh! I can't do it! I can't do it! The patient's gonna die! I don't know what to do! Now I'm gonna die. Oh, it's ribs. My bad. Excellent work. I didn't read what she said. Bone stapler. Bam! Cabana. Yes. Yes. This is for you. This is for you, Mopey. There, did it. What's this? A bit of bone paste. I'm pasting those bones. Excellent work, Doctor. Move clamps. New mode unlocked. Hard mode. Log in. Log in to unlock hard mode. Hard heart surgery. No, I'm alone. Go try this at home, guys. Okay, I'm not gonna. I like how he comes in with his soccer ball, like, he had a life, guys. He was gonna be a soccer star! His mammy and pappy told him he was always going to be the newest soccer professional. I don't know any really good soccer players. So now you're attached to him. Now if he dies, you'll be sad. That's how it works. Okay, different game, please. Oh no.